Hi, I'm Dr. David Shapiro. I'm here with Amy, and Amy just got treated in our office today's your second treatment.
Correct.
And I'm just going to let her share her just quick story with you. It's really, really interesting, and I think this might help a whole lot of other expectant moms out there and feel and function better. So why don't you just share with me what's going on?
So pretty much what happened is I was experiencing really severe pelvic pain, and I call it severe because I could barely walk, and every movement was so painful. So I was doing a lot of research online, and a lot of people were saying, oh, you know, this is pretty normal. I'm 21 weeks pregnant. They say usually you get it in the second trimester and it goes through until you have the baby. I called my OB. He said, just take some Tylenol. That's not something I wanted to do. So I went ahead and did some research, and I saw I saw an article actually that talked about chiropractic care and how it could be fixed. So I went on Google and I found you guys, and I called you, and I remember we spoke over the phone. I'm like, I need an appointment today, and they were able to get me in the same day, which was great. I had a consultation, did an adjustment, and pretty much went home. It was late afternoon. I woke up today and I got out of bed. I was walking. My pain went from a 10 to probably a 2 or 3, and that's only with certain movements. So I'm doing a lot better now. I feel better. I slept better last night. I wasn't tossing and turning and waking up all night. I literally slept like a baby.
That's
It was
awesome.
perfect. So I woke up super happy. I was excited about my second appointment today.
That's really
But
cool.
I really want to thank you because
you're
it
so
really it made a big difference, and I'm glad I didn't have to, resort back to, having to take Tylenol or just, stressing out about that on top of everything else that comes with pregnancy.
Yeah. So why didn't you want to take Tylenol? Because a lot of doctors, you said you would be prescribed that. So why didn't you want to take that?
I didn't want to do that because, I want everything natural for my baby. I don't want to take any medicines, and then that's also not good. It's just going to mask the pain. It's not going to fix anything. So, I didn't want to keep on taking it for a prolonged period of time, because I know that I even looked that up yesterday as well, and it causes like ADHD and all kind of things to your child. If you take it over a prolonged period of I think 4 weeks, you're putting your risk up 30%.
Wow.
So I was like, no, I need to go a natural route.
We're looking for a natural approach. Awesome. And your pain was different. I just want to, last thing I want to mention, your pain was different. Look, we see a tremendous amount of patients who are expecting and people with back pain, and that's a common thing. Sciatica and back pain is really common with pregnancy, but you happen to have a kind of even a different kind of pain, which is oftentimes, I'll just let you know, it's more unusual, and it's also usually more complex for most people to deal with, and so just if you would just briefly describe what your pain was.
So my pain was front pelvic pain, and it was pretty much all in the front area. I didn't really feel much in the back. And a lot, when you Google that, a lot of times you'll hear, like, you'll read responses based on the lower back, and when they're talking about pelvic pain. But no, this was specifically in the front, and, with any walking movement, getting up from a chair, shifting your legs, lifting your legs, then you can feel that pain there.
Awesome. Yeah, and that's really upsetting when you know how important it is to stay fit and active when you're expecting, and you want the best for your baby, and you clearly do, and you took a natural approach, and fortunately, even in just literally one treatment, you already are feeling better, and I'm looking forward to continuing to relieve that pressure and make it so that you have just a super easy, great pregnancy and a terrific and easy delivery.
Yep. So I definitely recommend you guys, if you're having the same symptoms, experiencing anything like I am, to definitely check you guys out and get that relief you're looking for, pretty much.
Thank you so much, Amy.
Thank you.
Appreciate you sharing your story.